The goal that when we developed this, our aim was for it to be used by all sizes, all types of employers, because we think the issues that workers face are going to be true, throughout different industries, occupations, and sizes of organizations.
The National Institute for Occupational Safety and Health has developed a new tool for assessing worker well-being, the NIOSH WellBQ, a tool which was designed to be used by any organization to assess the well-being of their workplace. Cha-Cha Chang was part of the team that developed this new tool.
The NIOSH Worker Well-Being Questionnaire, or the WellBQ as we like to call it, provides a comprehensive and holistic assessment of worker well-being. It provides an integrated measure for well-being across multiple spheres. The NIOSH WellBQ is intended to be used for workers across all industries and occupations, and is suitable for all types of work arrangements: full-time, part-time, contingent, non-standard work arrangements.
The NIOSH WellBQ is based on the worker well-being framework. Each domain is a critical aspect of a safe and healthy employee.
There are 5 domains for worker well-being. One is workplace physical environment and safety climate. That refers to the physical features and also the working conditions, such as safety climate. A second domain of worker well-being is work evaluation and experience. It includes the psychological and psychosocial workplace context. The third domain of worker well-being is workplace policies and culture. That captures aspects of people's lives relating to the organizational policies. The fourth domain of worker well-being is health status. That covers all the usual things we would think about, overall stress, overall mental health, physical health. This last domain surrounds everything I've just talked about. This is the home, community, and society domain. And that addresses all the things outside of work, because we know that people don't live and work in a vacuum. You have your whole outside life. The NIOSH Worker Well-Being Questionnaire provides metrics for many different topics, all the things that you would need to know for knowing how workers are doing. You can use it to set benchmarks internal to an organization or workforce. You could use it to examine changes over time to assess the impact of changes to your policies or programs, or if you develop interventions. And you can use it to compare results across different teams or units or facilities. Of course, you would need to control for demographics and control for differences in, occupations and job categories. But we do think if you control for those things, you can use them to compare the well-being of workers within an organization over time.
The WellBQ works like this. First, management must include workers in decision-making about the NIOSH WellBQ and commit to using the results to make necessary changes to policies, programs, and/or practices. Second, communicate to employees the purpose of the survey, the intended outcomes, and the privacy protections that are in place for their feedback. Third, administer the survey. Fourth, analyze and share the results. Fifth, take action on the results. Sixth, re-administer the survey at a later time and look for changes from the actions taken.
It is up to you to decide how often to administer the NIOSH WellBQ. It depends on if you've made any changes to the workplace and how long those changes would need to take effect. If you're making a change that you think you could see a difference pretty quickly, then you can administer it a little more often. But we do think it could take a while for some policies and programs to really make a difference.
In order to increase participation in the NIOSH WellBQ, communicate with your employees the purpose and uses of the survey. For example, with assured confidentiality, workers will be more inclined to give honest answers.
First of all, there must be informed consent. Workers must be aware of why the survey is being administered and the objectives and the end outcome that you're trying to get from it. Make sure that there's no linkage between the individual responses and actual workers. And your plan for keeping the data private and confidential should be communicated to workers at the outset. Why should organizations care about the well-being of workers? Well, because there has been data showing that it impacts things such as engagement at work, productivity, turnover intention, job satisfaction, customer satisfaction, client satisfaction, even healthcare costs. Particularly right now, it's a tough environment to be hiring people. The companies say that they're short-staffed and they're having trouble finding people to hire. So if you want to be a competitive employer, demonstrating that you have policies and programs and a culture that support worker well-being is really important. We believe the NIOSH WellBQ is a useful tool that employers could use to understand how workers are feeling about different aspects of workplace policies and culture, and identify opportunities for strengthening worker safety, health, and well-being, which will, of course, in the long run, improve organizational outcomes also.